Sure, sure. So it's a phase 3B study, which is very important because it applies to clinical patients in the real world. And this study initially was for moderate to severe psoriasis and looked at bimekizumab, an anti-IL-17A and F dual inhibitor, versus secukinumab, which is an IL-17A inhibitor itself, and a very, very common and worldwide popular anti-IL-17, one of the first ones that was approved for commercial use. And it was a 1 year initial study, and then it had a 3 year extension. So the first part was double blinded. So the patients were always getting something. But at a year, those that were on bimekizumab were transitioned over to secukinumab to see if they responded or if they had a better response. But this paper in particular was looking at patient-reported outcomes in that and not necessarily efficacy in terms of BSA or PASI. But of course, we did look at that as well. Absolutely. So one of the key findings is what were four main things. First of all, the rapid onset of efficacy and improvement of the patient's reported outcomes with the bimekizumab versus secukinumab. There was no itching, no skin pain, no scaling, and patients had reached a PASI of 0 and a DLQI of 0 or 1, which is very low based on a scale of 30 after one dose of bimekizumab. So that is the week 4 finding. So that showing the rapidity of onset. At 1 year, what was found was symptom resolution, where no itching, which was higher with bimekizumab, no skin pain, which was higher with bimekizumab, and no scaling, which is markedly higher with bimekizumab. Of course, not all patients had no itching, no skin pain, or no scaling, but compared to secukinumab, the quality of life, the majority on bimekizumab was higher than secukinumab. But I do want to say that secukinumab is still an excellent drug. This is just a head-to-head in terms of comparison. So patients still continue to do well on secukinumab as well. And in addition to this, at 3 years, so that's a long time to stay on a drug because a lot of people find that, oh, it tends to lose efficacy over time. But on 3 years, looking at bimekizumab particularly, and that stayed on bimekizumab, is you had this persistence, this high and sustained rate of no symptoms with itching and pain and scaling, which is a sign throughout year 3. And the DLQI of 0 or 1 was sustained by year 3 and continued during 3 years. And also a durable achievement of a PASI of 0 as well, in combination with a DLQI 0 or 1, because not everybody that has clear skin has a low DLQI. There's still other components that affects. An important key finding was that those that were switched from secukinumab to bimekizumab actually had further improvement. So by year 3, the PASI of 0 and a low DLQI was similar between the continuous and the switch drugs. So in other words, those that were on bimekizumab from the start compared to those that were on secukinumab from the start and that switched had further improvement. So maybe this additional benefit from switching from bimekizumab from secukinumab to bimekizumab showed that you could capture more improvement in PROs and low PASIs.